Our Digging Deeper series on the state of mental health here at home. Last night, we shined a light on the services we do have in our community and the ones we still need to grow.
Yes, but the bigger issue as I dug into this story was that while we can debate what services we need more of, the biggest issue people here in the state line have with the current state of mental health is how state insurance takes certain treatment options from some to almost none.
So when you're told that you can't have the services that are the residential, it doesn't make sense why they would be able to see you every week, but then not see you for the more intensive things. So then you're sent out of state, like I said, or out of city, and that's how are parents supposed to be able to do that, especially if they're on a fixed income or single families.
Britt Cotton has traveled miles on an exhausting road to mental health care. She's already lost one child to suicide, and even though she's fought every day to get her daughter the services she needs, all she has to show for it right now is pain and frustration.
It's looked like over 10 hospitalizations since the beginning of 2020 and 2 residencies, and just waiting in between and hoping that things go okay, and sometimes it not being okay.
The struggle is to find inpatient residential service close to home in Rockford. But with their state insurance, she says even staying in the state feels like a lost cause.
The state itself of Illinois is pretty much, if you're on state insurance, you're really not going to get in unless you do the FSP grant.
An FSP grant is an added step where families can get access to residential care and other behavioral health services, but Cotton says the application process puts way too much stress on parents.
You're going to be looking into getting a psychological eval yourself, and it's not comprehensive. You don't have help through it. They're not telling you exactly what tests need done, what tests don't need done.
People experienced with mental health in our area say the process and massive wait lists are forcing families out of the state.
Probably at least 2 to 3 times a month, I'm getting calls about somebody that needs to get inpatient and they're getting shipped off to Chicago or they're getting shipped off to Wisconsin. And they're like, why is there no place here that can help my child?
And for parents who go through that grant application, well, they can count on a lengthy wait.
People typically have to go through an application process to ensure that they truly need the care. And it can take Medicaid 3 to 6 months, sometimes even longer, to approve that.
Wait times, Britt Cotton says, put her child in danger.
Like many, many nights of tears and just a constant fear that you'll wake up and that person will not be there the next day.
And it's not just Cotton. NAMI, Marshmallows Hope, and Rosecrans say there's an overwhelming amount of people on state insurance who are struggling to find help. Just like a rough percentage, how many of those people are using state insurance like Medicaid?
That are reaching out to us?
Yeah.
I would say 85+%.
Well, so 90% of the clients that we see here through Marshmallows have Medicaid insurance.
The issue is that the need is great for those that have state insurance. And the workforce hasn't grown to meet those needs.
The good news for people like Cotton is that there is some progress. On Wednesday, Illinois Governor J.B. Pritzker said he would try to end what's called prior authorization for insurance companies. The quick version of prior authorization is that insurance companies can require doctors to prove the patient needs the care and often use this process to try to deny coverage. In recent years, insurance companies have expanded the use of prior authorization, making patients wait months for care when minutes matter.
It means patients suffering a mental health crisis can get the care they need without jumping through hoops designed to deny coverage. And we're going to make sure that insurance plans publicly post all treatments that require prior authorization so consumers can compare plans when they're shopping for coverage.
And as for Medicaid and residential health care, Laura Kane with Marshmallows Hope says talks are going in the right direction for better access and turnaround times.
I have been working directly with one of the representatives from Medicaid who has, given explicit detail of what changes are happening and what changes are coming. And they are acceptable. They are actually trying to fund more initiatives.
But a timeline for when these changes are a reality for people like Cotton remains up in the air. And I have been in talks with Medicaid throughout the entire day trying to get answers about these potential changes. All they had to say to us is that there are avenues through the state insurance to get residential care, though you just heard that doesn't always come easy. So as you also heard, they did not comment as to how long this exhaustive process takes, though you heard some commentary there from Rick Cotton.
Yeah, and no matter when or if they make changes, people like Britt Cotton say they've had enough. She plans to move out of the state in the coming months to a state with better mental health care.